noon, so we'll call the meeting to order. First order of business is they're not on the phone yet, but they're supposed to be. So I want to approve Rachel Relaford and Rob Renault for the phone. Betty, second. Eden?
And Kate.
Oh, and Kate. I'm sorry, and Kate. Eden, a second. All those in favor? Aye. Any nays? Okay. Next order of business is approval of the October 26, 21 minutes. Do I have a motion, please? Linda, second. Jennifer, any corrections? Additions? Okay. All those in favor? Aye. Aye. Any nays? Okay. Moving on to informational items. We'll start with the Board of Health. Morning. Monica?
Good afternoon, everyone. In your packet is a recent Board of Health agenda meeting minutes. More than happy to answer any questions on that, as well as just a couple of highlights. Our Community Health Needs Assessment and Improvement Plan. This is the Tri-County singular plan that's done by the local health departments, hospital systems, and United Way. The first round of data collection is complete, which was our community survey. We did do it slightly different this year. I kind of tell everyone this is our junior year, the third cycle that we're about to start. And part of that is we did divide Peoria County as well as the other counties into smaller regions, so by various zip codes. So for Peoria, for example, it is going to be divided and data will be analyzed in a 6-region area. That way we can see where we have areas of inequity that might have previously been diluted based on the larger size of our population, and where we have severe disparities, we can identify them rather quickly. In addition, just a quick COVID update. Right now, to date, we are just under 29,000 cases to date. Our county is averaging about 75 new cases each day. So we're back in that surge capacity, largely unvaccinated individuals. We are seeing some that might have received their first dose of vaccine in February or March, and that again just highlights the need for boosters. And so just as a plug, we are doing walk-ins at the health department, 8:30 to 4, Monday through Fridays. We have all 3 vaccines in terms of boosters, as well as first doses for adults, as well as children. We will be starting the walk-in clinics for the under 11 population as well. Right now, we're sitting at just at 53.5% of our population fully vaccinated. The good news is we should see a huge jump at the end of this week, and that's because the first round of second doses start for our community for that age range of 5 to 11. More than happy to answer any questions.
Are there any questions? Go ahead, Eden.
How do we compare in vaccination rates to other counties in Illinois?
We're definitely in, I would say, the top 25 counties, depending on different age groups. I think what we're starting to really focus on now is not necessarily first doses. We still want to get the remainder of our population as much as possible with that first dose vaccine, but really are trying to focus on boosters. I think it was well said that we're kind of in a scary situation right now where people who did the right thing and got vaccinated now feel that they have a little bit more freedom, and so maybe their kind of caution has gotten a little bit less, but without the booster, it's a very nervous caution that they should be expressing. And so again, that's why we really want boosters to be pushing it. Anyone that has had the mRNA vaccine 6 months after their second dose or 2 months after the Johnson & Johnson.
Any other questions? No other questions? Okay, thank you. Do we have a care and treatment board?
No, we don't have anyone from Care and Treatment.
Okay, thank you. Moving on, EMA. Jason, hi.
Good, I think it's probably afternoon, isn't it? Good afternoon. So I did submit just in our monthly report, and I'll kind of review, as Monica had mentioned, we continue some certain COVID activities with the EMA, primarily a lot of just ensuring that we monitor a number of webinars and things, situational awareness that gets provided. Standard meeting attendance, and I think I discussed this at the last meeting or shared this, but we're really in the EMA trying to get back to what is the new normal is under COVID, and planning and preparing for some various hazards. Exercise-wise, I did want to point out that we were asked by Woodford County to help facilitate a tabletop exercise over there, so we participated in that, as well as over in East Peoria was a pretty informative exercise on, I don't know if people are familiar with the Farm Creek Dam, but you know, some activities, a hazard that they have in East Peoria that should there be an incident there, that what we would be able to assist with, we wouldn't be directly impacted. So, equipment status maintains. The biggest issue with the equipment with the outdoor warning sirens is not our willingness or desire to fix some of these sirens. It's a supply chain issue, so we're just running across, you know, just getting a speaker so that our vendor can install the speaker type thing. Any of the sirens or speakers that are speakered down would be sirens that they may be like say a 8 siren speaker or 8 speaker siren, so 7 of the 8 are working, and again we get the daily polling every day, so we keep track. We're maintaining that, which sirens might end up having an issue overnight when we do that test. So miscellaneous. I just wanted to share one thing on resource request. Monica had mentioned our COVID vaccine clinic, so I guess this maybe be a shout out to. We've really relied on volunteers since January of last year when we started vaccination clinics. We're struggling now, so if you know of individuals that want to assist in vaccination clinics or at the health department, you can direct them to us. But we're starting to see some burnout from some of our volunteers. In fact, some of our volunteers have put in a lot of hours, and so just one of the probably first hiccup we really ran across with respect to staffing our vaccination clinic. So I did submit a request to IEMA this morning for some staffing and spoke with our regional individual on that.
So if someone's interested in doing that, do you have a phone number or something that they could?
Yeah, they can contact, you can give them directly my number. I'm 309-679-6020.
Okay.
Or my email, which is jmarks@peoriacounty.org is the best way, because if I get an email, then I'll get it almost any time. So.
Okay.
And we can get them tied in, both medical and non-medical volunteers, believe it or not. Our nurses that we've had are worn out, and even our clerical. We've had a couple clerical people that they just came to us this week, and Jill had some talk with them. You know, they didn't want to, but you could tell, and so we just think it's best if we start trying to give them a little bit of a break, and so they're great volunteers. We don't want to lose them.
Yeah, we appreciate all they're doing.
Yeah, they're helping out.
Okay. Any questions for Jason? Yeah, Brandy, go ahead.
No. So we'll take, Jill does talk to them, and we've had an issue before, both in the EMA as well as with the MRC, where we've had to ask a volunteer, we've had to relieve them of their duties simply for things, but it's no skill set. We both need both clerical individuals, and then if they have skill sets, so if they're registered nurse, then we can, we'll utilize them with those registered nursing skills. But if it's just an individual just wants to help, we've got all sorts of clerical duties that are really beneficial when we get them in there. Right now we'd be 8 to 4:30, so that's the clinic we're struggling maybe a little bit with, is the one we're having at the health department. So 8 to 4:30, and it's they don't have to work the full time. If they can give 4 hours in the morning, then we'll schedule them for 4 hours. But we're Monday through Friday, aren't we? Yeah, we're Monday through Friday there. Yeah.
Thank you. Jennifer?
For the volunteers, is it strictly for the vaccination clinics, or are there other areas in need of volunteers?
We haven't needed any, well, I take that back. We do have our volunteers working, doing some outreach with homeless population, so some testing at those facilities. The volunteer that's working that location, we don't have a vacancy in it. She's great, and she loves it, and so, but primarily it's COVID related right now as anything, and it would be in those vaccination clinics.
And I had one other question. In terms of the equipment that you're waiting on the supply chain for, do you have any estimation on when you'll see any of that, or is everything currently held up?
It doesn't matter. Yeah, it's not like there's one thing. In fact, I think there was a couple weeks ago, Mike called me one day and he's like, hey, I picked up 4 speakers. They showed up here. I'm going out and installing them in these 4 sirens. Is that cool? Just to make sure that those are the sirens we wanted to work on. So, but no, it's the supply chain issue that we're running across.
Any other questions? Okay, thank you.
Thank you.
Regional Office of Education.
Hi everyone, how are we today? Everyone good? All right. I wanted to start my report with some gratitude to thank again the Peoria City County Health Department for their partnership. They joined our superintendent call again this Monday. We're seeing a surge in your schools again. We have 2 particularly impacted schools, and a third, took a phone call this morning. Have even had entire schools go out on remote learning, if you're familiar with the Princeville community, and so it's just a challenge. It's happening in our younger kids, and so that impacts the school and classrooms and the way we do business, and so I'm just very grateful for their partnership, because Monica and her team are always willing to jump on the call and talk us through, I don't know, contact tracing, testing supplies, all the things. So that's kind of where we're at with that. We're still in the thick of it, and it's heavily contributing to the same burnout that he was talking about, very much so with your educators out there for sure. So in response to that, I'm very excited to announce that we are going to be included in some social and emotional learning hub work. A $900,000 grant has come into this area out of ROE 1, which is the Quincy area. But I have an employee that's going to be a part of that, and she's going to be offering that work to our local school districts for free. So we used to have to do it at a contract basis, but now that I can offset her salary, we're going to be able to support our school districts, and that's coming through federal dollars from COVID relief to support children. And so I'm very excited about that, and we're getting that up and running. I wanted to let you know that we've also got some exciting things still going on with ICC. So in the morning, I am the co-chair of the Emerging Workforce Committee that's under the Regional Workforce Alliance, run out of ICC and with our business partners. So my committee focuses on K-12 and anything that we can do to get ready to be college and career ready. So tomorrow we're doing an audit with our districts with the Illinois Student Assistance Commission to talk them through where are they at in the PACE framework, which is all the activities they're supposed to be doing with middle schoolers and high schoolers to get them college and career ready. And so we're going to look at where they're at on the framework and try to figure that out, and then what supports do we need to be put in place. So that meeting is in the morning, and at that meeting I'm also hosting GPeak. If you will remember, I think I've shared this with you, that it's an online, module-based, credentialed, essential skills, employability skills, workforce skills, people call them different things. So that came through a partnership with ICC and Northern Illinois University. So I'm piloting that at our high school out at Peoria Regional, and I'm hoping to get more schools to buy into that and to try that, because they get a credential that, like, they've been through this online module training, and when they go in to apply for a job, they can bring that certificate in with them. So I'm excited about that. And then I attended, Sheila Quirk Bailey hosted an IT summit about plugging in that pipeline, which is desperate out there. All the businesses and employers that were in that room that are just desperate at every level of IT in every industry. And so I went as the educator of what can we do with students to get them on that track. So I'm going to be plugging into that as well. And last but not least, I just wanted to leave you with a couple positives. I've been out, now that I'm boosted and masking, I went out and I'm observing some of my staff in the field. So those of you that know John Meisinger, former principal of Richwoods, works for us for adult literacy. I went and observed his tutor training. Fascinating. So if anyone in this community that needs to boost their reading skills, can't read at all, needs supports, that program is outstanding. And I found out at that meeting that the average reading score of people coming in, adults, first grade, 4th month. So they take them from that and help them. Maybe they want to get employed at a certain job, or they want to get a promotion, but their reading skills are blocking them from that. It's all free. They meet their tutors at the library. If you ever come across that need, find me. I will connect you to John Meisinger. We have great tutors, and they can support these people for whatever it is their goals are, whether it's just to read better, read to their grandchildren, or get a better job. And then I also went out and observed our community classroom on Wisconsin Avenue. To remind you, Diane Duke runs the GED programming at the Peoria County Jail. We can't exactly be in the jail right now because, well, COVID, which is like the answer to everything, right? So to try to meet the need of our grant, we're working with the Peoria Police Department at their community classroom on Wisconsin. And I went and observed that and watched her teach. And these were older women. I can say that because I'm over 50 now. So they were trying to, and just listening to them learn how to read and struggling to read and pass that part of the GED was, it was fascinating, it was humbling, and it was exciting to me because it was such a need, because both of them want to plug into a better career. And those are just some of the services that are out there. So I wanted to give you an update on that. Oh, I'm sorry, one last thing. I wanted to update you on this. So, I was going to give you a copy of these, but it's exhausting, and if you want a copy, I'd be glad to give it to you. One is an action plan with Unity Point. We are working with them on the Systems of Care grant. It is a very large dollar amount that has multiple partners as part of it. We're just one partner. And it's the idea of no wrong door. So if you whatever door you come through as the client, how can we support you in behavioral and mental health? Whether that's through unemployment or wherever someone would come in, their pediatrician, that we can support. But like some of their action plans on here are phenomenal, but the print is really small too. And so if you want a copy, I'd be glad to give it to you. And then this one I'm really proud of as well. So this is part of the partnership so you heard Monica talk about the survey. That survey always hits hard on mental health. It always spikes. Every year that I've been a part of getting the results of that survey, mental health is number one. And so as part of that mental health team, I have a person on that team who also reports to the Systems of Care. This is their action plan. And one of the things on the action plan is, how could a school become designated as trauma informed? So it's not just knowing about trauma, but what are they going to do about it? And how are they going to use smart alerts like what I've come to talk to you about, and that we have decided as a county that we want to fund. So all of that, this is their draft plan of what they want to do with that to encourage schools to go through that learning. So again, trying to get at that mental health piece. And I wanted to share both of those with you.
I think I'd like to see both of those. Could you just email them?
Of
out?
course.
Yeah.
I'll send them your way, and if you have questions, you can certainly.
Beth, you can send them to me, and I'll put them in the weekly update.
You got it.
Thank you. Any questions for Beth? Yeah, Brandy.
So there is a poster that says adult literacy in the break room downstairs. It's got my logo on it, but I will send that to Scott as well. The GP, we're piloting that right now in our high schools. And then it looks different depending on the high school. Like maybe they take all the sophomore English class through it, or maybe we have a special class that we use out at Wildlife that we're gonna take through that.
Anything else, Brandy? No? Okay. Jennifer?
Originally, you mentioned a $900,000 grant coming to the local school districts. I missed what that was for.
Okay, so it's coming to ROE 1, which is my counterpart in the Quincy area. She's Cass, Brown, Morgan, Scott, blah, blah, blah. She's got like 8 counties. I just have you. So she's based out of Quincy. She got the $900,000 grant. It's for SEL, Social and Emotional Learning, hub work. So it's the money that came from the federal government to address mental health and social emotional learning needs that came out of COVID. It's going to that ROE, and my employee is now going to be paid out of that so I can offer those services for free.
Anything else for Beth? Okay, thank you, Beth. Sustainability. Becca, welcome.
Good afternoon. I have just a few updates or additional information to add to what you received in the packet. For collections, we did do a collection with Limestone Township at the end of September and collected 5,211 pounds, and that was a little bit of a pilot with an appointment-based system for being able to drop off electronics. It was successful. It was just a quick 8 to noon collection with some work by the Limestone Township staff. So it was a good partnership there. Also with collections, we are doing a holiday light collection, which we've done for a number of years, I think since 2011. We've collected holiday lights, and we're continuing to do that again this year with a community partner of Forest Park Nature Center. And then here for our employees at a number of locations as well, and that will run through January 5th. The other additional item that I wanted to expand upon was the landfill section. On November 18th, the landfill committee did meet, and the 2022 budget was presented to them. They're looking at it and will look at adoption at the December 8th meeting. That is, I didn't include it in the packet, and I apologize for that. The timing was off a little bit, but it is available online at the website that's listed under landfill. If you'd like to take a look at it, it is based off of 170,000 tons coming into the landfill, which is also what the 2021 budget was based off of as well. And I think that's what I have.
Okay. Any questions for Becca? Go ahead, Steve.
The second item you have under collections, maybe you could articulate a little bit the opting into CIRA and the permanent location, just maybe a little more detail?
Yes, so that is the producer responsibility legislation or option that we have chosen to participate in the last few years, and that's run through the IEPA. It's a national program, but with the population that we have, we are allowed to have one permanent location, which is Kusakowski, or we chose one permanent location so that there's year-round collection. And with the population, we're allowed to have 4 one-day collection events. There is some labor that can be charged with that, but otherwise the items are accepted for free. And so we do have 5 part communities that have expressed interest, and I need to submit what those 4 will be within the next week or 2, so I'm working on that right now. And the pilot that we did with Limestone Township this year's hopefully will serve as an example of what those townships can expect and what their commitment would be to make it a little bit easier for residents to do an appointment-based collection, knowing what we're going to be receiving ahead of time. You know, how many televisions more specifically than the small items. Takes out some of the guesswork.
Thank you. Anything else? Okay, thank you, Becca. Moving on, we are at discussion items. First order is grant to Triad. How do we want to tee this up?
Well, I think, Madam Chair, the committee last month had a discussion about a follow-on discussion from the presentation that you had from Triad 2 months ago. There was, I know, conversation from Mr. Renault, who's unfortunately not able to be here today, about making a one-time contribution to the Triad program. I know some of you have talked amongst yourselves to maybe land on a number, but I don't know exactly what that number might be, so probably best to have a discussion from the committee on what that number might be, and then if there's a consensus from the committee, we'll go ahead and process the paperwork to make a contribution in whatever the value the committee deems appropriate.
So after speaking to many of you, we sort of landed on the $500 mark. I just want to kind of hear what everybody's saying, and if $500 is appropriate. And
joined.
Is that Rob?
It is Rob.
Okay. Rob, we are discussing Triad right now. Did you want to make any comments?
Oh, just in time. What's been discussed before, so far?
We just started, so.
Okay. Yeah, I kind of stand by what I said last month, that I feel it's a worthy organization that fits within some of the services that we no longer provide for our seniors. And I would advocate for a $2,000 donation to get them started back up.
Okay. Are there any comments? I know most of you thought $500 was an appropriate number. Any thoughts on what Rob is saying? Because we really need to kind of come to a consensus here on what we want the number to be. Go ahead, Eden.
I'm okay with a slightly higher amount, like 1,000 or 2,000 as a startup fund with the rule that it's a startup fund and it's not something that's going to happen every year.
Right. Okay. Anybody else? Steve, any comments?
I think maybe just clarification, we used the word startup last time. I think it's more of a renewal.
Yeah.
Because they've already been in place.
Yes.
They just need, as the speaker a couple months ago educated us on, they're trying to implement this process back in for our seniors.
Right.
So, yeah,
Launch.
whatever the right words, just words. But, you know, from my standpoint, I'm okay with, you know, the 500, you know, give them something. You know, I made the comment last time, you know, I guess as long as a committee agrees on kind of the why, as why we pick certain organizations to fund and other organizations we do not fund, and we can stand up to the community and explain where it fits. I think Rob made a comment that was relevant, that, you know, we had the nursing home and some other senior services that we probably have, you know, shrunk on the county services. So if you put it under the category of supporting the senior citizens and the services within the county, I could get behind that for, you know, I'm not going to tie it to a hard dollar, but to 500, or if we think a different dollar amount is appropriate.
Okay. Thank you, Steve. Anyone else? Linda, we'll start with Linda back there.
I guess what I think is, I think $500 is fine. I could do $1,000, but I want them to come back and tell us at the end of a year what are outcomes that they've had as a result of our donation that they wouldn't have otherwise. That's what's important to me. I mean, I don't know how much money they actually need or what the number of clients would be they'd be serving, but that's something I think we need to tie to our donation.
Okay. Great. Any other comments? Betty?
In regards to the 500, I'd like to see the 500 simply because, again, I understand it comes under the sheriff department, but at the same time, our community would see that, and would they be asking for funds, and is this another way of, you know, supporting our community? And then in addition, will they be held accountable for how they spent the money, or are we just giving it with no accountability? So that is my stand on that.
Yeah, I think I agree with Linda and Betty on that they do have to have accountability for, you know, the funds that we're going to give to them. So, you know, maybe we can have Mr. Bierce back just to kind of talk about, you know, what they're going to do with the funds, you know, the grant that we give them. So do we want to make a decision today, or do we want to have Mr. Bierce back to speak to what the money will be used for? Phil?
I don't want to speak to the question that you just asked, but going back to the presentation and so forth, at that time, I really felt it was a worthwhile project that they're starting to go in the right direction because, as I said before, senior citizens, and we did take away the nursing home, which was so vital to many of our senior citizens, and I think these these people that are working on this project are taking us in the right direction. I don't feel $500 is adequate. I would like to see a larger donation to these people. I would favor $1,000 at least.
Okay, Jennifer?
I think we can probably meet in the middle somewhere, look at 1,000 or 1,500. I agree that we need to put out the message that we value our seniors and appreciate them. I thought the presentation was great, and I think we could put some parameters with that, you know, just so we know how that money is being spent. But I think it sends a good message to increase it somewhere in the middle. Everybody's comfortable with.
Okay, so is everyone comfortable? Can we get a consensus on $1,000? Shaking, Brandy?
I just had a question about, do we know what their goal for the money that they need for what they want to do?
Well, they're going to use it for seniors. They
No,
go out-
the amount. Like, is there an amount that they are looking for?
No, they didn't.
No, nothing like
No,
that. I didn't think, I didn't, okay. So just a donation?
Yes, or a grant. Are we calling it a grant? Yeah, grant. Oh, yeah. So can we get a consensus on then $1,000 and then have Mr. Bierce back to kind of tell us how he's going to use those dollars? Is everybody comfortable with that? Linda?
Yes, I'm comfortable with that, but at the end of a year, I want to know what they actually accomplished.
Okay.
I don't want to hear about what their vision is. I want to know what did they actually do.
Okay.
Madam Chair,
Yes.
can you just give me a quick synopsis of, I heard everybody except for Betty and Linda.
So go ahead. You're right next to him.
So, Mr. Renaud, I think what Member Daly and Betty have talked about is one, first and foremost, accountability. So, from Linda's perspective, is it's great to hear what the vision might be for how they use the dollars, but what's more important, and what's most important from Linda's perspective, is coming back a year from now and telling us what are the outcomes that they achieved as a result of the grant that we're going to make. How did they use those dollars? How did they affect change for good in the service areas that they're involved in as a result of the grant that was given? Did I misstate anything, Linda? That good?
No, that's right. And I mean, if they have great results, I'd entertain the idea of increasing it.
Okay. Great.
And
Okay.
if you're looking for, I would be happy to volunteer to be a liaison or even serve on Triad if we're looking for that type of accountability. I know we have somebody from the Sheriff's Department who's on it as well, but I would be happy to volunteer if you would like me to.
Okay. You want to talk to Mr. Bierce about that?
Sure.
Okay, great. So then are we?
I mean, I can either volunteer as a citizen or I can volunteer as a board representative. I'll leave it up to you.
Okay. I think I'd rather have it as a board representative.
Okay.
So, okay. So are we in agreement then on $1,000? Looks, everybody's shaking their head yes. So, okay, we'll start out with $1,000 and let's see what they do with it. Thanks, everybody, for your input. Our next order of business is a discussion on the Health and Human Service Campus. Scott?
All right. Thank you, Madam Chair. So we've got members of the design team present today. We've got some materials that are a little bit beefier than the outline that was in the packet. We've got hard copies available for committee members. We'll also be able to provide that electronically to the committee members that are not present, and we'll most likely actually provide it as an electronic copy to all county board members. So we'll walk through that briefly, asking for no vote or direction today, hence there's no resolution on the agenda today. But what we would be looking to do when the committee next convenes for your January 4th meeting for resolutions that go to the January County Board meeting, is we would have a resolution on that agenda in a month that would be for renovation versus replacement, and it'll include obviously what our recommendation is. So the materials that you're going to be given, and the team walking through those materials is really just to get your mind thinking about that decision point, and prepare you for a vote on a resolution next month on that next policy decision in this process. All right. So also just to point out for those committee members that may not know their faces, Dr. Armour, who is the current president of the Board of Health, and Mike Kennedy, who is a Board of Health member, are both in the audience today, eagerly listening to the presentation. So with that, Jack, you want to hand these out to the committee members, please? And if there's any extras, you can give them to Monica and the two Board of Health members. All right?
Group here in Peoria, and I'd like to advise you all against reading ahead. So this is an assessment of the existing facilities. So this is an assessment of the existing facilities. To do that, we met with the staff at each facility. We looked at the services offered in each facility and developed a program of spaces to meet the needs of those services. And then we looked at the existing facilities and their ability to meet the needs of the program that we developed, both physically and spatially. You lied.
Turn it up. It's on the side.
There we go. So this is the county health facility. This was built in 1958, 2 buildings, the health department and a tuberculosis sanatorium. And it's been added to several times, starting in 1962. The facility is currently undersized for the program of needs. As we get into renovating that building, it will be difficult and expensive to meet code requirements for energy, ventilation, the sprinkler system, and accessibility. In order to reuse that building, you'd either have to move everybody out or phase construction, moving portions of the facility to a temporary facility. That would both increase cost and timeline and be very disruptive to the activities at the building. There's asbestos in the building, though without tests we don't know how much, but we know that it's been encountered before. Currently there are multiple independent mechanical systems in that building, and it's not designed for distribution of a more efficient system. All of those things don't make it impossible to use that building, but they make it expensive. And overall, we had River City did a cost estimate comparing renovation costs with new construction costs. And overall, the construction costs to renovate this building are about the same as building new. And that assumes that there won't be unforeseen conditions in the building we discover when we start demoing walls and getting into things, working out what's under those floors. And even with spending the same as building new, there are constraints due to the construction type and the structure of that building, which would compromise the efficiency of laying out those departments properly and flexibly in the future. Based on all of that, we can't recommend reusing that building. Just to show you, that's the floor plan of the building. It's been added to several times. This shows circulation. It also shows mechanical spaces. On the main level, it is quite broken up, and a lot of those walls are structural walls and can't be moved. The coroner's office. What is? Okay, yeah, the slides do not correlate with the packet. I think that's fairer to say. So the coroner's office was originally constructed as a juvenile detention facility. It was converted to its current use in 2004, and the coroner's office does not use the entirety of the building. Phasing construction on this project does not seem to be feasible at all. Renovating this facility would require an alternative facility be found for both the offices and the autopsies that take place at this building. Fundamentally, the design of this building puts a lobby, a public lobby, between the staff and the autopsies. That means that staff performing those autopsies have to pass through that lobby with public people, which is not necessarily always safe. And also visitors to the facility can hear the autopsy tools being used. I have looked at this building and I cannot see another way of arranging those spaces. We'd probably have to do an addition to the building to make it work. The construction with cells at the perimeter of the building basically make those spaces are too small to use for the program. So they're used currently as storerooms and things like that. And all of the space on the inside of the building doesn't have daylight. Again, major renovation would trigger code compliance with this building for ventilation, sprinkler system, energy efficiency. Those all add to cost. And the ventilation system in this building, the building it looks sturdy from the outside, but it's very traditional construction. It's not designed to have a negative pressure, and currently when they have decomposing remains, the entire building is unpleasant. Again, River City did a cost estimate looking at renovation costs versus building new, and the costs were very similar. And when I say very similar, within 5%. It does not seem to make any sense to renovate this building for use as the coroner's department because of the way it's so dysfunctional. Even with with the costs and the dysfunction, and that's enough. We can't recommend it. Did I miss anything? All right. So there you have it. The buildings have been very well maintained. They're aging out. They don't fit the current purpose particularly well, and they are just as expensive to replace as to renovate. Any questions?
So you had mentioned that they're about the same to replace or renovate. As we look at future operating costs for things like utilities, energy efficiency, is it cheaper to have a new place that is more energy efficient?
I'd say it's likely to be cheaper. I think our costs, including trying to bring those buildings up to current energy code, with the new construction, we would probably exceed those energy requirements. So it would be less expensive to run. I would say that just as impactful on cost would be the efficiency of how we lay out those spaces in terms of employees and outcomes and patients served, rather than trying to lay out within the existing spaces and structures.
Okay. Linda?
Can you explain how you came to the conclusion that a new building would need 60,950 square feet?
Is that the program area?
So that's the building area, and that would include relocating the ROE and the health department together in one facility, which is why it's drastically more than the current.
Page 24 in the packet.
Right. So that number includes both the existing health department programs and the programs that will be relocated or co-located from the Regional Office of Education.
And so so the plan is to deliver the programs exactly the way they're being delivered today, not to investigate any sort of mobile programs, etc.
Mobile programs were not something that we studied. We did consult with staff. What would you want to do different? What would make your life more efficient? As we were looking at the spaces to determine the space needs.
Anything additional, Linda? Okay. Any other questions, Steve?
I guess one of the things we've looked at is what data do we have that says the amount of services that are needed, because we've asked this multiple times on, we know the services that we're providing today to the clients who use the services of each of these, if it's the health department or the other operations. But the question always is, how about the people who are not using it that could be clients and outside of the current zone and area? So I want to expand not just serving the current customer client base in our county, but the clients that are qualified and could be using the service throughout the entire county, and then understand to develop a service and a solution, not over design it, but understand what services and where they're coming from. And again, I'm not sure where that data, I know Monica, I've asked you before, kind of the bigger picture, because to me it's real easy to say, we know who we've been serving. We just look back at our service records and say, here's who comes and gets served. But I'm concerned that we're missing people who have not been served. And how do we put that into our scope of the work of services and offering, and then where kind of back to Linda's comment is, where's the optimum place to provide the service for the people who need it? Is it building one central campus that we tell everybody, if you want the service, come to our campus, or do we bring the service closer to where the people are that need the service, which might be a leased space, a smaller space, a collaborative space with Heartland Health or other organizations? To me, that's a major question that we'd like to at least explore and understand.
I think there are two directions I can answer your question. The first is that this study is just about the existing buildings and whether they should be reused, and it's not about where the health department should be located. That's coming up in the future, and that's in the next discussion. What is part of our study is how do we build in enough flexibility so that programs can grow or change without suddenly like the building becoming obsolete. And that's very important to the design process, is understanding what change may occur and trying to allow for some of that in the future.
Okay, and again, I can see that in the next phase. I think the current phase of this topic is refurbish the buildings or replace. I understand the refurbish is a very undesirable cost and such, so that's not really a debate in my mind. It's that next step going forward. Who needs the service and what's the best way to provide those services, and give us some flexibility so as the needs change over the next 10, 15, 20 years, we didn't make a facility that's a JDC facility that we're trying to make a coroner's office out of that doesn't really work. Kind of design in the ability to accommodate shifting of services. That's really I'm looking for going forward.
I think Monica has some comments.
Hopefully this is still on. Yeah. No, I appreciate that thought process about, in the future, what does the health department and who they serve. I think the first thing to recognize about the health department, which we do a lot, but is that we are grant funded, and so our clients that are eligible are very limited. So, for example, WIC is not countywide eligibility, meaning that any pregnant woman is eligible. There's an income base. There is different poverty levels depending on our programs that actually qualify. So when you look at who actually is able to utilize that service, the geographic makeup of that is concentrated and has the highest rates of use or eligibility actually in our 61604, 05, and 03 zip codes. We will never argue that there are individuals in Chillicothe and in Elmwood and in Dunlap that would qualify for some of our programs, but the actual the numbers are very, very limited because, again, all of these are based off of poverty level. Having said that, we actually already do a lot of mobile activity. Our dental clinic actually goes through early Head Start. We have a standing agenda with Valeska Hinton to come in and do clinics there. We actually go to different high schools and middle schools around the community. Our WIC is actually now able to be more mobile because we just got onto what's known as the EBT card, and that is part of the plan, is to be more mobile. But I think the key to recognize is that the programs we do, because of our grants, we have only a specific eligibility requirements, and that population is very much concentrated by both the number and by rate of use in our central city area. In terms of Heartland, because I think that's a great example, Heartland actually approached us because an area where they saw a gap was the 61604 zip code based off their service model data on a federal side. So that's why they have continued to be a partner, and I know we will work with them depending on the decisions by this board to make sure we understand that location and what it means for them. But I think what's really important, and I appreciate what Farnsworth and River City have brought forward and their due diligence, is the fact that they were able to, I think, visualize that we're very constrained by the physical dimensions of our facility to even currently serve the population we want to, versus even trying to start thinking about that expansion point.
Steve, anything additional? Okay, Jennifer?
Monica, while you're still up here, won't a lot of Steve's concerns be addressed when we see the results of the community needs survey? Isn't that essentially what we're looking at as far as who are we missing, what is needed, and so forth, in terms of making sure we're addressing the needs of the county as a whole?
So I think that's a great point. The community health needs survey is it's driven by your local health departments and your hospital systems, but we recognize that the work is done across the board. And there are definitely partners that work on solutions for the health priorities that have historically been strong partners with the health department. A great example has been Heartland Health Services. Whether we were looking at cancer, heart disease, reproductive health, and now even substance use, Heartland has always been a key partner, and that's why when in 2018 we approached Heartland to actually co-locate with us, because we were able to identify them as a key partner. There are multiple other ones we'd love to bring to the table, but currently our facility does not support that.
Linda?
Somewhere in here, does it actually identify the numbers or the zip codes of people that use the health department services?
No, this was just an assessment of those facilities, so we're not bringing in that data at this point.
Okay, but again, I don't understand how you determine the size of a building and the services that are going to be used if you have no idea how many clients are coming to use those services.
So we met with each entity, and so we do have a understanding of the clients that are coming based on how many visitors from the public are accessing the building daily. In terms of outreach, additional, that will go with the survey that Monica's team is doing. But in terms of the services and the actual like quantity of space, the amount that we have put in the program is the appropriate like ratio of spaces to clients that would come in, if that makes sense. So you can still see multiple people through the programs we've provided, but based on staff needs, based on future development 5 to 10 years out, this program still is holistic in terms of how many people she could see within a now time and in 10 years time. Sorry, I'm nervous.
And Monica, would you tell me, do the dental clinics that are in the schools, do they do more than sealants? Do they actually take care of cavities and things like that?
Great question, Linda. It's a little bit of a mix. So when our health department, when the Peoria City County Health Department works with the school, we will go into the schools and do preventative exams. And then for any caries or cavities that are identified, the appointment, because it's a little bit more robust of a procedure, they will then be have an appointment made at the health department for that follow-up procedure. Sealants we can do in the schools, we can also do it in the health department. Where it becomes difficult, and I know you know Dr. Bishop, you've worked with her for years as well, and she's a huge advocate, is the situation where we have independent contractors that might go into schools that would like the reimbursement of a preventative exam, but then do not do the follow-up treatment course. And so families will end up either at the emergency departments or at other facilities, but more than often they come back to the health department, and then we have to restart the entire procedure with them. But overall, our partnership, again, in the programs and the way our health department is set up is that we take on state insurance plans. And so again, the population we serve is highly centralized in our community that we currently serve, but we do a model which is already in the schools to do some preventative work, but the majority of our in-house is going to be treatment.
Well, Dr. Bishop, I think, does a wonderful job, but there are virtually no dentists that take Medicaid-eligible patients. So I have had to send people as far away as Chicago. So my question is, again, what there is a critical service, how is that addressed in this plan?
I think where the key, and I appreciate this conversation because I think the other part of this key though is we are currently funded to a certain point. So we are a 1 dentist, 1 hygienist, and 5 dental assistant program. That is our current funding that we can support. If we were to wanting to expand, then that would not only, just by adding more exam rooms does not necessarily allow us to see more clients, because we then would need to have more dentists and hygienists also. And I think that's the balance that when we were discussing with the architectural firm as well as the construction management risk, which is our current funding that allows us to only be at 75 FTEs, is built in a way that we can maybe broaden the number of exam rooms and clients, but when we continue to grow, then we really have to talk about changing our funding model, or how much is supported to the health department to take on this that's outside of the grants we already seek.
Okay, any other questions? Mr. Ricker?
No.
Oh,
All right. On the ROE co-location, just for clarity, is it administrative roles for the ROE, or do we have some service delivery that will be done at the facility from the ROE's standpoint?
So on the pages in the booklet, if you look under organizational services, it's page, stinks to be over 50, 13. Our vision was our number one priority was to coalesce all of the Regional Office of Education Services into one space. I am currently all over the place. And so for a good example, it's just here in this facility. Across the hallway, George and I have an office, the Assistant Regional Superintendent and I, and there are 4 employees over there. But down in the basement is our Student Services Support Team. That's the homeless liaison, and that is our Student Services / Truancy Department. So that is another group we would bring over. We'd love to bring over one of our preschool for all classrooms and that administrative. Also within this, there are certain ones of them that pay rent. So those spaces would need to pay rent on the space that they would have at this new facility. So when you look through that list, it's about bringing all of those components onto the same campus. The last piece I would share is the GED, Illinois High School Equivalency Testing. That requires an actual testing facility. If you've been to my office, you've seen it right here across the hall. We offer the computer-based GED testing. So that would also be a component that would go with us. But right now, when I have a meeting of staff, and I'd love to bring my professional learning staff over as well. Currently, they are working remotely as I close down my Edwards facility.
Okay, well, thank you for that additional. So if I look on page 16, I see under Regional Office of Education space, as you kind of articulated the calculations. So you've got the testing center, professional learning team, student services. So you've got a total space of 5,475, and you had a preschool of 1,575, and then you have the regional learning center, which is not part of this. Add in, or just make clarity. Is that part of the number?
I just found that out. So that was my dream that the high school would go as well. But that was a dream. That was the vision. That was think big. I mean, George and I asked for an indoor pool. So, okay. So that was my dream. And so I see that in the co-location that's not currently part of maybe what the vision is.
And I guess I'm not against dreaming big. So start with, and then start defining what fits, what makes sense, and what we can afford, versus leaving it out and then later on saying we missed an opportunity. So I'm all for put it in to begin with. Let's work through it, figure it out, and then what we can deliver, what fits, and what meets the budget, let's go with. So I'm just trying to get some clarity, because that 60,000 square foot on whatever that other page was kind of all adds up to all the services that we're putting into it.
Right.
And we can look at it that way as well. So page 17 for the co-location, all of those numbers would add up minus the Regional Learning Center. And at this time, we have decided to kind of leave it where it is, because that would be yet another assessment that we would want to look at. But in the future, we can also add that 5,550 square foot in. So the 60, we'll say 61,000 square feet for a building facility with the health department, the regional learning offices, and the preschool for all plus the high school would be closer to 65 or 66. And then based on today's decision, we're trying to co-locate those, and if they would co-locate, they'd ideally go on the Sheridan site with the Peoria Health Department, and that health department right now is roughly 40,000 square foot total, and so if we did co-locate all of those, we wouldn't be able to renovate at this time because we would be short about 25,000 square feet. So for this assessment, we were trying to figure out what, in terms of square footage, could we co-locate and still be able to renovate, which that high school at 5,000 square feet, almost 6,000 square feet, really would have been a big ticket item that we couldn't have relocated because we just don't have enough room in the current facility.
Okay.
Jennifer?
I'd like to request that maybe we bring this phase back to committee again. Just, there's a lot to digest here to instantly look at it and I don't know what my questions are right now.
Yeah, that's why I want to wait before we have any action items on this. I want everybody's questions to be answered, and we want to look at this, take some time to look at it. I don't want to make any quick decisions. I want us to have time to be comfortable with what our decisions are. Okay, Dr. Blair?
And just to be clear, those next decisions are renovate or create new. That's the only decisions we're making at the next at the next time that we vote on this.
Yes. Yeah, and then from there, then we'll start discussing location, square footage, all those sorts of decisions will come later.
And that will tie into Linda's questions too. We're really, for the next step, going to dive into zip codes, where everybody is coming from, because if you decide to just renovate, then the location doesn't matter and the zip codes aren't necessarily as important. But then if you choose to replace and potentially the location could change, we really do want to evaluate where the residents are coming from, so that way it is the best location for the new facility.
Yeah, and I believe Scott is working on that, correct?
Yeah.
Yes. Scott's working on various locations that if we decide to replace, that we can take a look at that would fit within what we need for the facility. So, Phil. Mic on. Thank you.
What I'm concerned about is something that every department seems to have a problem with. I think we're going in the right direction. I would love to see us have a new building, bringing these different departments together and so forth. That's great. But when our facilities committee went out to tour a lot of the buildings, the number one problem was storage. Nobody ever has enough storage. And when you design any building, you ought to double the amount of space for storage. I don't know how you guys go about figuring it, but the coroner, he had terrible space for storage. The sheriff's, even though that is a newer building, they still have problems. This building, it's got storage problems. Storage is one of the biggest problems that we have in this whole county. People say, oh, do it electronically. You know what? There's some things they can't do electronically. And so my advice to you would be take care of the storage, because it is a major problem in this whole county among our people. How do you go about figuring storage?
So when we met with each entity, and we do have square footage of storage in each one, and we've actually had those exact questions of what can be electronic, what's going to be future electronic, and what do you have to keep. And we actually have an understanding of, in terms of even timeline. So some files you have to keep for 5 years, some you have to keep for 10, some you have to keep indefinitely. A lot of the coroner's offices you have to keep indefinitely. So we met with Monica and the ROE and Jamie and determined, what do you have now? Is it efficient enough? Where are all your storage places? Because a lot of them are kind of throughout the facility. And then again, right now we're just kind of focusing on renovate versus a new facility. But if a new facility is decided, then we would look at that probably even further detail to actually make sure Are you bringing all your storage to one location, and then can it be shared, and things like that? So just continual questions to each entity would be how we would go about that, and just making decisions wisely to see if paying for square footage at a facility is worth it, or even just using a third-party storage vendor, and then we can have those conversations with Scott too.
Linda, did you have something else?
Actually, she answered my question, because there's more than one way to do storage, and so that's excellent. I mean, to build in a lot of storage in a brand new building seems a very expensive way, but I certainly agree with what Mr. Salzer said, that we have a terrible storage problem.
Okay. Any other questions?
Madam Chair, just to expand upon Ellen's comments as relates to, and Linda's comments, the storage requirements that the county has is obviously not unique to this project, as Phil alluded to, and we, in many instances, we are at the point where we actually need to look at third-party offsite storage that does require us as an organization to be better than we are today at how we manage and index those paper records that either we have to maintain for a certain amount of time before destruction, or we can never destroy. Because when you go to a third-party offsite storage solution, you don't get to go retrieve the box that the record is in. The third party does that for you. So you have to know which box every single record is in, and it has to be indexed the same way the recorder of deeds indexes all of the documents that they take in electronically. We have to do that for paper records, and some offices are better at that than others in this organization, but it's something that we all need to be cognizant of as we continue to struggle with long-term record storage. But it's something that we're keenly aware of and we are working on at an organizational level.
Okay, thank you. Any other questions? Okay, all right. And I believe we are at miscellaneous. Is there any miscellaneous? Any miscellaneous? Okay, we're adjourned. Thank you, everyone.